Stretch 12. Standing lateral spine flexion. Standing lateral spine flexion is one of the most complete and accessible movements for improving spinal mobility and releasing the tension that builds up with age. Contrary to popular belief, the body doesn't lose mobility just because of aging, but mainly due to the lack of daily movement. This simple exercise can restore a great deal of that freedom. To do it, stand with your feet shoulder-width apart and keep your knees slightly bent to avoid straining your lower back. Take a deep breath, raise one arm above your head, and as you exhale, slowly bend your torso to the opposite side, stretching the entire side of your body. You should feel a gentle stretch from your waist to the outside of your hip. Hold the position for a few seconds while breathing deeply, then slowly return to the center. Next, repeat on the other side. This movement mobilizes the thoracic and lumbar spine, stretches the oblique and intercostal muscles, and boosts circulation in the tissues around the spine. From a scientific standpoint, lateral flexion promotes hydration of the intervertebral discs, helping to reduce morning stiffness and prevent degenerative conditions such as spinal osteoarthritis. Additionally, when combined with deep breathing, the movement activates the vagus nerve, which regulates the body's relaxation response, lowering cortisol, the stress hormone. Doing this sequence daily helps improve posture, relieve lower back pain, and restore tissue elasticity. It's a safe, adaptable, and highly effective exercise for people over 50 who want to regain mobility without straining the body. Stretch 11. Standing quadriceps. Stretch. The standing quadriceps stretch is an essential exercise for keeping your legs strong, agile, and pain-free. The quadriceps are responsible for stabilizing the knees and powering movements like walking, getting up from a chair, or climbing stairs, activities that can become more difficult with age if this muscle group isn't properly maintained. To perform it, hold onto a wall or sturdy chair for balance. Bend one knee, grabbing your ankle or the top of your foot with the hand on the same side, and gently pull your heel toward your glutes. Keep your knees aligned, core slightly engaged, and spine upright. You should feel a stretch in the front of your thigh. Hold the position for 15 to 20 seconds, breathing deeply, then switch legs. This stretch directly targets the quadriceps femoris, a muscle group that, when tight, increases pressure on the kneecap and can lead to knee pain. By releasing tension in this area, you also improve circulation, reduce the risk of cramps, and increase endurance while walking. Studies in aging physiology show that regular quadriceps stretching helps prevent falls, improves stability, and preserves the strength needed for everyday activities. To intensify, gently move your knee slightly backward to open the hip more, which can also help relieve lower back discomfort. But remember, the movement should always be controlled and within your limit, never forced. With daily practice, this stretch brings lightness back to your legs, improves knee mobility, and increases confidence in your movements. Key factors for anyone over 50 who wants to maintain independence and quality of life. Stretch 10 to 90-90. Hip stretch. The hips do more than just let you walk freely. They act as the central pivot for your entire mobility. When they're stiff, the whole body feels it. Your legs become heavy, your lower back becomes overloaded, and even simple activities like climbing stairs or getting up from a chair become tiring. The 90-90 stretch is a simple yet highly effective posture for restoring mobility in this essential area. For this exercise, sit on the floor with one leg bent in front of you at a 90-degree angle and the other leg bent behind you, also at 90 degrees. This position creates a deep stretch in the hip adductors and internal and external rotators, muscles that are rarely activated in everyday movements. In addition to stretching, this exercise promotes pelvic opening, improves postural alignment, and reduces pressure on the lower back during prolonged standing or walking. Another key benefit is the stimulation of blood circulation in the pelvic region and legs. This movement aids venous return, helping to reduce swelling, heaviness in the legs, and even common issues like varicose veins and edema. Additionally, since it's a stable position, the 90-90 stretch enhances body awareness and balance control, two essential factors in fall prevention during older age. If you feel too stiff, You can modify the exercise by placing cushions under your knees or supporting yourself with your hands behind you, making it accessible even for those with joint limitations. The goal is not to force, but to let the body gradually and respectfully open up. With just 2 minutes a day, this stretch helps relieve built-up tension in the hips and thighs, restoring lightness, stability, and a sense of control that many feel they've lost over time. That's why so many physical therapists consider the 90-90 a key movement in mobility routines for people over 50. Stretch 9. Seated cat. Stretch. The seated cat stretch is much more than a simple gentle movement. It acts as a powerful relaxation tool that works on both the body and the mind. This posture involves sitting on a sturdy chair or bench, placing your feet flat on the floor, slowly leaning your torso forward until your chest comes close to your thighs, and letting your arms hang freely toward the floor, as if they were heavy. It is especially beneficial for people over 50, as it relieves tension built up in the lower back, hips, and shoulders, areas that tend to stiffen over time due to stress, poor posture, or excessive sitting. From a biomechanical perspective, this stretch passively elongates the paraspinal muscles, which support the spine, the glutes, and the hip joint capsule without requiring intense physical effort. This movement helps release compression in the lower back and restore elasticity in the deep tissues that support the spine. Additionally, by allowing the abdomen to rest lightly against the thighs, it improves diaphragm expansion, enhancing breathing quality and providing an immediate sense of relief. This exercise is ideal for ending a stretching routine or practicing before bed, as it calms the mind and prepares the body for rest. From a scientific perspective, sustained relaxation postures like this one activate the parasympathetic nervous system, also known as the rest and digest mode. This system regulates vital functions such as heart rate, blood pressure, and the release of calming hormones like serotonin and oxytocin. Stretch 8. Knees to chest. The knees to chest stretch is one of the most effective and therapeutic movements for relieving lower back tension, improving postural alignment, and stimulating the autonomic nervous system. It involves lying on your back in a comfortable space, bending your knees, and gently bringing them toward your chest while keeping your shoulders relaxed and resting on the floor. It may seem simple, but the physiological benefits of this movement are profound. Bringing the knees toward the torso gently decompresses the spine, reducing pressure between the intervertebral discs, especially in the lumbar region, which is often most affected by sedentary behavior, poor posture, and age-related loss of abdominal strength. Studies published in the Spine Journal and the Journal of Geriatric Physical Therapy show that passive stretches like this help restore spinal mobility, promote disc hydration, and reduce myofascial tension in the paraspinal muscles. This muscular and joint release is essential for people over 60 who suffer from chronic stiffness, lower back discomfort, or pain caused by long periods of sitting or standing. Beyond structural benefits, the knees to chest stretch has a restorative effect on the parasympathetic nervous system, which regulates rest, digestion, and recovery processes. When combined with slow, deep breathing, the exercise stimulates the vagus nerve, reducing cortisol, the stress hormone, and promoting a general sense of calm and well-being. Stretch 7. Arm raise with spinal extension. This exercise is simple, yet incredibly powerful for restoring thoracic spine mobility and improving posture, especially for those who spend a lot of time sitting or hunched forward. The position involves standing with feet shoulder-width apart, interlacing the fingers, raising the arms overhead, and as you inhale deeply, stretching upward as if trying to grow a few centimeters taller. Although it may seem like a basic movement, its effects are profound. Spinal extension helps open the chest, stretch the abdominal and intercostal muscles, and reduce compression caused by years of poor posture. This stretch also encourages diaphragm expansion, improving breathing and increasing oxygen flow to the tissues. Physical therapy studies show that spinal extension movements significantly reduce morning stiffness and increase lubrication of the intervertebral joints, helping to prevent lower and mid-back pain. Additionally, by activating spinal stabilizers and erector spinae muscles, this exercise supports a taller, more confident posture. Regular practice improves circulation, eases shoulder and neck tension, and helps reduce pain associated with a sedentary lifestyle. To adapt the exercise, those with limitations can keep a slight bend in the elbows or perform it seated. The key is to stretch gently without forcing and hold the position for 20 to 30 seconds while breathing deeply. With just a few minutes a day, the arm raise with spinal extension brings back vitality, improves body alignment, and offers a sense of lightness that carries into every movement of your daily life. Stretch 6, neck stretch with lateral tilt. The neck is one of the areas most affected by aging, whether due to poor posture while looking at screens or the natural loss of elasticity in the cervical muscles. Stiffness in this region can lead to headaches, shoulder tension, and even mild dizziness due to impaired circulation. The lateral neck stretch is a simple yet highly effective movement for restoring mobility and relieving discomfort. To perform it, sit on a chair or stand with your spine upright. Let your arms relax at your sides. Slowly tilt your head to one side, bringing your ear toward your shoulder. Do not lift your shoulder toward your head. Keep it lowered to enhance the stretch. To intensify, you can gently place the hand on the same side over your head for light support, but avoid pulling. Hold for 20 to 30 seconds, breathing deeply, then switch sides. This stretch targets the sternocleidomastoid, scalene, and upper trapezius muscles, which are often shortened due to slouched posture or stress. From a scientific perspective, regular cervical stretching improves blood flow to the brain, reduces tension headaches, and increases proprioception in the neck area, essential for balance and coordination. In addition, this movement activates neuromuscular receptors that reduce involuntary muscle contraction, easing the sensation of shoulder heaviness and neck stiffness. It also improves posture by releasing the tension that tends to pull the head forward over time. For people over 50, this means less daily discomfort and greater confidence when walking or performing simple tasks. It's best to practice daily, preferably in the morning or after long periods of sitting. In just a few minutes, you'll feel a looser neck, lighter shoulders, and an immediate improvement in posture. Stretch 5, ankle rotation. Stretch. Ankles are one of the most important joints for mobility and balance, yet they are often neglected. Over time, stiffness in this area can increase the risk of tripping, falling, and experiencing pain while walking. The ankle rotation stretch is simple, can be done seated or standing, and helps restore range of motion while improving circulation in the legs and feet. To perform it, sit on a firm chair with your feet flat on the floor and lift one foot a few centimeters off the ground. Make circular movements with the ankle, first outward, then inward, for 10 to 15 rotations each direction. Repeat with the other foot. If preferred, it can also be done lying down with the leg slightly elevated, which makes the rotation easier. This exercise gently stretches the muscles and ligaments surrounding the ankle joint, such as the anterior tibialis and gastrocnemius, and also stimulates movement in the small joints of the foot. Physiologically, it improves joint lubrication, prevents sprains, and supports venous return, helping reduce swelling, heaviness, and even nighttime cramps. Geriatric physical therapy studies show that improving ankle mobility can reduce fall risk in older adults by up to 30%, as it enhances proprioception, your body's ability to sense its position in space. It also improves walking stability and makes simple activities like climbing stairs or walking on uneven ground easier. This stretch is extremely safe, adaptable to any fitness level, and can be done at the beginning or end of a routine. Just 2 to 3 minutes a day can help your feet and ankles feel more mobile, your steps feel steadier, and reduce discomfort after long periods of standing or walking. Stretch 4, wall chest stretch. The chest and shoulders are areas that suffer the most from the hunched posture typical of people who spend a lot of time sitting or looking at screens. This tightness pulls the shoulders forward, strains the cervical spine, and reduces breathing capacity. The wall chest stretch is simple and effective for reopening the chest, improving posture, and making deep breathing easier. To perform it, stand next to a wall or doorway. Place your palm, forearm, and elbow on the surface, keeping your arm at a 90-degree angle. Slowly rotate your torso in the opposite direction until you feel a stretch in the chest and front of the shoulder. Hold the position for 20 to 30 seconds, breathing deeply, then switch sides. This movement stretches the pectoralis major and minor muscles and releases tension in the shoulders and upper trapezius. Physiologically, opening the chest this way promotes lung expansion, improves oxygenation, and reduces neck pain associated with poor posture. Postural therapy studies show that regularly stretching the chest muscles helps correct the rounded shoulder posture common in people over 50 and prevents strain on cervical discs. It also improves blood circulation in the upper limbs, relieving tingling and heaviness in the arms. This stretch can easily be adapted. Those with limited mobility can keep the arm at a smaller angle, and those with greater flexibility can rotate the torso more, always respecting the body's limits. Practicing this stretch daily brings immediate benefits: better posture, less shoulder tension, deeper breathing, and even a sense of mental lightness, since opening the chest also encourages a more confident and relaxed posture. Stretch 3. Seated hamstring stretch. The hamstrings located at the back of the thighs tend to shorten easily over the years, especially in people who spend long periods sitting. This shortening not only limits leg flexibility, but also increases strain on the lower back and contributes to pain when walking or getting up. The seated hamstring stretch is safe, simple, and highly effective for restoring mobility and relieving tension. To perform it, sit on a sturdy chair, extend one leg forward with the heel resting on the floor and toes pointing upward. Keep the other leg bent, with the foot flat on the ground. Gently lean your torso forward, keeping your back straight until you feel a stretch in the back of the thigh. Take a deep breath, hold for 20 to 30 seconds, and then switch sides. This movement directly stretches the semitendinosus, semimembranosus, and biceps femoris muscles, which make up the hamstrings. Physiologically, it helps reduce tension in the lower back, improves hip range of motion, and increases walking stability. Additionally, functional geriatric studies show that keeping the hamstrings flexible reduces fall risk and improves gait speed in older adults. Another benefit is improved blood circulation in the back of the legs, helping to prevent heaviness, swelling, and even cramps. It can also be easily adapted. Those with less flexibility can keep a slight forward lean, while more mobile individuals can deepen the stretch, always without forcing. Daily practice of this exercise restores leg elasticity, improves posture, relieves lower back pressure, and brings a sense of lightness to everyday movements. In just a few minutes, you'll notice the difference when walking, sitting, or even bending down to pick something up. Stretch 2. Shoulder and upper back stretch, cross arm. The shoulders and upper back tend to accumulate tension over the years, especially in people who spend hours sitting, typing on a computer, or looking at a phone. This tightness can limit simple movements like reaching for objects, putting on a shirt, or even lifting the arms overhead. The cross-arm stretch is simple but extremely effective for restoring mobility and relieving pain in this area. To perform it, stand or sit with your spine upright. Extend one arm across the front of your body at chest height. With the other hand, hold the arm near the elbow and gently pull it toward your chest until you feel a stretch in the shoulder and upper back. Keep your shoulders relaxed and breathe deeply. Hold for 20 to 30 seconds, then switch sides. This exercise stretches the posterior deltoid, trapezius fibers, and rhomboid muscles, areas prone to tightness due to poor posture and lack of movement. Physiologically, it improves shoulder flexibility, reduces cervical strain, and helps correct misalignment caused by tight muscles in the front of the body, such as the pectorals. Orthopedic physical therapy studies show that regularly stretching the shoulder girdle improves shoulder range of motion, reduces neck pain, and supports better posture. Stretch 1. Figure 4. Glute stretch. The glutes are essential muscles for stabilizing the hips, lower back, and even the knees. Over time, and especially due to prolonged sitting, they can lose elasticity and strength, contributing to lower back pain, hip stiffness, and discomfort while walking. The Figure 4 stretch is simple, safe, and highly effective for releasing tension in this area. To perform it, sit on a sturdy chair with your feet flat on the floor. Cross your right ankle over your left thigh, forming a 4 shape with your legs. Then gently lean your torso forward, keeping your back straight until you feel a stretch in your right glute and the outer part of your hip. Hold for 20 to 30 seconds while breathing deeply, then switch sides. This exercise stretches the piriformis, gluteus medius, and gluteus maximus, muscles that play a vital role in balance and posture. Physiologically, releasing this area helps reduce pressure on the sciatic nerve, preventing or relieving radiating leg pain. It also improves hip mobility by reducing the stiffness that limits everyday movements like squatting or standing up. Studies in motor rehabilitation show that regularly stretching the glutes increases pelvic stability, improves walking mechanics, and lowers fall risk in older adults. Another benefit is improved blood circulation and reduced heaviness in the legs after long periods of sitting or standing. The stretch can be modified. Those with more difficulty can keep the torso upright and simply rest the ankle on the thigh, while those with greater flexibility can lean slightly further forward. The key is to respect your body's limits and perform the movement gently. With daily practice, the Figure 4 glute stretch restores hip mobility, eases lower back tension, relieves sciatic nerve pain, and strengthens the foundation for all your body's movements.